This is Selma Schimmel in Chicago for the Group Room. We're at the 2012 Multidisciplinary Symposium in Thoracic Oncology, which is brought to you by ASTRO, IASLC, ASCO, and the University of Chicago. Joining me now is Dr. Fred Hirsch, Professor of Medicine and Pathology at the University of Colorado Cancer Center. Hello, Dr. Hirsch.
Hello.
We're actually going to get to speak to a pathologist now and talk about what is the role of pathology in lung cancer.
What we have seen over many years is development in molecular techniques, assays, molecular knowledge about tumors. Within the last years, it has also come from the laboratory to the patients, particularly in this case lung cancer patients, which I'm working mostly with. What has brought it to that is we learned about important mutations, particularly EGFR mutation, epidermal growth factor receptor mutations, and we learned that this mutation drives a tumor into a malignant phase. If the patient has an EGFR mutation in the tumor, then we know from many studies today that this patient will benefit from having an EGFR TKI, which is given as a pill, an oral treatment with modest side effects compared to the conventional chemotherapy. Then we learned about ALK rearrangement, which is another genetic abnormalities. And for those patients who have this particular abnormality, they will benefit from a specific therapy called ALK inhibitor. So, and we learn more and more and more about new subgroups of patients based on molecular characterization. So by the sudden, the pathologist has come into the center of a multidisciplinary approach to lung cancer management.
So the first thing I would ask for is a copy of my operative report and my pathology report. And it astounds me still the number of patients that don't know yet that that's a very important document that they need access to. And so maybe you can just take a minute to talk about this transitioning role, because while lung cancer now may be the real area where the pathologist is emerging, it's not limited to lung cancer, and the role of the pathologist must be changing in oncology very rapidly.
No, you're absolutely right. Previously, and when I grew up in fellowships and training, the pathologist was sitting in an isolated department and send out the pathology report. But today it is important that we have multidisciplinary tumor boards, so the pathologists, the radiologists, the oncologists all can sit around the same table and discuss the approach to be taken for this particular patient. I still believe, though, the communication between the patient and the doctor should be between the patient and the oncologist, but the oncologist needs to convey messages from the pathology department in a way that the patient understands importance of molecular testing.
If a patient wanted to talk to you and could get through,
absolutely,
would you?
Anytime.
And have you ever had a patient call you and say, Dr. Hirsch, may I talk to you about my pathology?
Absolutely. But that is rare cases. Most commonly, the messages are conveyed through the primary coordinator of the team, which in terms of therapy systemic therapy, chemotherapy, or targeted therapy will be the oncologist.
Well, I think that this time with you has opened up a food for thought, but most importantly, you have put a face to pathology, highlighted molecular pathology, and quite frankly, there are many patients who've never even seen a pathologist. You are their first glimpse of a pathologist, and you're so important to our care. You're like one of the main guys, and we would like to do more to expose you.
The pathologist role will be more and more important, and the communication within the multidisciplinary team will be more and more required, and might be we one day will end up in the situation you are describing, which I personally like, communication, if necessary, if the patient wants it, with a pathologist.
Thank you. Dr. Fred Hirsch, Professor of Medicine and Pathology at the University of Colorado Cancer Center.
Thank you so much for the invitation.